We could end the pandemic as a pandemic by the 4th of July if we took action right now. Wouldn't mean we have no new cases, certainly, but we could end the pandemic phase, I guess we would call it. And I know that many of you know we've already missed a number of opportunities to do this. Back on March 5th, I'm being very generous by looking at March 5th. We had all the information we needed about the spread of the virus. We should have taken immediate action. Donald Trump should have said to all 50 governors, listen, we need a 50-state stay-at-home order. We have some very, very difficult days ahead, but we will be better off if we all do this now. Instead, on March 5th, we did nothing. On March 5th, we ended up doing only 500 or so tests. By March 15th, we were still only doing about 1,000 tests a day. By March 25th, we were finally up to 80,000 tests, which was still not nearly enough. We were so behind. And still to this day, we aren't doing enough tests and we don't have any federal contact tracing initiative. So opportunities have come and gone. But once again, we have an opportunity in front of us to deal with what we are dealing with right now. And we could be in very good shape nationally by July 4th. Alex Tabarrok and Pooja Olhaver wrote a really good piece in the Washington Post outlining the bipartisan plan that they participated in putting together. And it's important that this plan considers the medical and the economic. I've been taking the economic seriously from day one. The right has been having a grand old time framing leftists as not caring about the economy, as not caring about unemployment, not caring about economic destruction. The truth is, I and most serious leftists have been concerned from day one with the economy. And the reality is that 6 months of rolling lockdowns in some parts of the country, some open, close, that's not going to be good for the economy either. There's a plan that's been written, and the testing element is a big part of that plan. We need to dramatically increase testing. How innovative? It's not surprising, but we are still not testing enough. But the test levels are very specifically outlined by this plan. We need to be testing everyone who has symptoms and all of their contacts and have enough capacity for what we call surveillance testing. People just go in even without symptoms because there is such asymptomatic spread. We need everyone who has the disease and their contacts to self-isolate. We may need hotel rooms for people to be able to self-isolate depending on their situation at home. We may need stipends for people who are self-isolating while they cannot work. And what the plan does that is really important is it divides the country into 3 types of zones: green zones, yellow zones, and red zones. And the plan acknowledges, which a lot of right-wingers want, that rural Montana doesn't have to do the same thing that New York City needs to do. Green zone would mean fewer than 1 in 36,000 are infected. You can do large gatherings in green zones. You don't need a mask in green zones unless you are part of or around folks who are in vulnerable populations. You need 1 test per day for every 10,000 people in green zones and 5 contact tracers for every 100,000 people. That is not a lot for the green zones. Now, right now, there are not very many green zones. 2 weeks ago, we could have had 19 million Americans in green zones based on our testing levels. Right now, we don't have any active green zones that are meeting these requirements. Then we get to yellow zones. Yellow zones are for most of the country right now. 298 million Americans right now would be in what we call yellow zones. That's where the disease prevalence is somewhere between 0.002% and 1%, okay? In the yellow zones, the economy can reopen, mandatory masks for everyone, and you need 2,500 tests for each daily death, plus much more contact tracing. You need to have enough contact tracing to contact every person who's been in touch with an infected individual within 12 hours. Why within 12 hours? Because if you wait 3 days, it's too late, and those people have been going around potentially spreading the disease. So, for example, based on the last few days of deaths, New Jersey would need 250,000 tests per day. But Maryland would only need 87,000 tests per day. These are much bigger numbers than what we have, but these are not cartoonishly high numbers based on the models that we've seen. So you've got your green zones and your yellow zones. Then you've got your red zones. Red zones are more than 1% of the population is infected. Right now, there are about 30 million people in that situation. That's just under 10% of the country. So in those red zones, you have everything that the yellow zones have in terms of testing and tracing, but you also have a stay-at-home order. If you follow it, the red zone becomes yellow relatively quickly, by 4 weeks in most analyses. And then you move to yellow, and then the whole country could be at minimum at yellow by the 4th of July. That means the whole country could be open, although yellow zones would still have more precautions like mandatory masks. And we could be at green by the end of the summer. We're not even close on testing. We're now testing about 350,000, 375,000 a day. We need somewhere between 3 and 5 million a day. And based on current numbers, we're nowhere near that. This can be done, but we're way behind. If we started today, we could be in pretty good shape for moving red zones to yellow and yellow to green heavily around the 4th of July. Seems to be no political desire at the federal government. Trump's acting like we won. He's talking about super duper missiles, but this is a plan that works. Test, trace, and isolate. South Korea succeeded with it at the earliest. New Zealand did it. Taiwan did it. Greece had a milder version and they still did it, although it took a little bit longer. Greece is looking at opening up for travel very, very soon. Prevention is cheaper than the cure. Testing is cheaper than both the economic destruction and the costs of treating way more sick people. Here's another plan. The plan is based on right now. It's mid-May. We could do this. We could be in very good shape by July 4th.